Hello and welcome. You are in for a treat. The Black Women's Healthcare Summit, held by let me get the name correct, Women's College Hospital and its sponsors. It is in its fourth year here in Toronto, Canada, and it was a fantastic, fun filled, women empowered event. It was just a blast. And I will show you a few snippets, sights, sounds, and tips. But I won second prize. It was very fantastic. It's an iPad if you don't know the box. So I'm adding it to my list of gadgets, and I will obviously need to learn this because it's my first iPad. So I'm very excited. I want to play a few sounds and points that came out from our panelists. The panelists were just so engaging, so inspiring, a lot of helpful information, and I want to share a few points that I pick up. I tend to write, and this video is one of those that is just raw. So one of the things that came out, especially from the skincare dermatology panel, was that Black dermatologists are very rare, which lends itself to long wait time. So your referral can be in the months. Additionally, I hope I got the stats correct, but there is a estimated one black dermatologist for every 100,000 black people or black persons. And that is horrendous. We talk about the need to solve healthcare gaps, and this is obviously a healthcare gap that needs solving. Another tip, especially for us women who, I don't think this is for only women. Let me just take that back. For people, is to wear sunscreen and to be consistent in your sunscreen regime. So this is very important that, under your makeup, before you go outside the house, you are wearing sunscreen. And of course, especially for women of color, traditionally there was this like white film when you put on your sunscreen, and so tinted sunscreens are what is the rage right now. It has iron oxidized, I think it is, and it supports the protection that the skin needs against the rays of the sun. Of course, with any Black women's event focused around healthcare, hair becomes a key part of that conversation. And at this summit, alopecia and its various forms was a major topic on the agenda. And we had clinicians giving their input and support in terms of advice and answering questions, general questions. But there was also a wonderful, beautiful woman who told her story around her journey with alopecia, a particular kind of alopecia. And so you could hear both.
I started losing my hair probably in my late teens, early 20s. My scalp is inflamed, it's very sore, it's very itchy, it's burning, and it's also bleeding. When I finally decided to go to a dermatologist, I felt like I left with more questions than answers. The emotional aspect of it was never a topic of conversation. It was more or less like, it kind of felt like it was more of a cosmetic thing, like, we're sorry you're losing your hair, but there is no cure. I felt like I had to hide my alopecia because I didn't like looking in the mirror.
Perspectives around alopecia.
Things we try to do is block inflammation so that things don't progress. Because what we're trying to do, or at least traditionally what we've tried to do, is retain hair as opposed to grow hair. So in broad terms, alopecia is a broad term, and really what you want to do is find out your particular diagnosis, and oftentimes people can have more than one diagnosis simultaneously.
And what would you say are some of the top, causes of hair loss in women with afro-textured hair?
I think if I had to break it down to the top three, I'd say androgenetic alopecia, so female pattern hair loss. And we see that in all skin tones and hair textures. So oftentimes people have thinning over the crown, or they might have temporal recession, like myself. And that's gonna affect about 40 to 45% of women. And then I'd probably say number two in women with afro-textured hair is traction alopecia. So traction alopecia, we do it to ourselves with styling. Micro braids, weaves, anything where there's going to be tension along the particular area. It can be the hairline, but it can be really any area of the scalp.
It's all in me. Anything you want done, baby, or do it naturally. I'm every woman. It's all in me. I can see it all right now.
One of the points that came out, and this is so indicative of persons who work in the clinical setting, where community, patients, clients complain about the short clinical consultation time that they have with their doctors. Like they're not given enough time to explain the condition, the symptoms, so that the doctor is able to, properly give a diagnosis. And this was a point that was raised, and I wrote down two thoughts. One, there is this burden on the client or on the patient to be organized, to know what they're experiencing, what they're feeling. Like they need to do all of that before they enter the room. So there is this burden that's placed on the patient for us to know what is, how we're feeling, note these down, maybe the time frame that the onset of the symptoms came, just writing down everything, like we know what we need to do, right? So that when we go into the doctor's office, we have this fully laid out list of things that we're now going to, give to the doctor, and they're going to now be able to help us. So that burden has remained on us, and especially for marginalized populations who no one has taught them, what they need to write, what we need to say, um, how we need to control our emotions to make sure that they, whether it's a non community member provider, they're from a different racial group, they may not understand the nuances that's happening to you. Like you should have it all figured out so that you can support them. But I think we need to shift that back. Like we need to shift that back to the healthcare sector. Like minority populations, we have been given a raw deal. Like we have not been supported in our healthcare journey. We have had really bad health outcomes, for decades, for centuries. And how do we shift that burden from the burden being on us to the burden being on the healthcare system? And we know that the healthcare system is overburdened already, but inherently that burden should be on the system. And I think that it should be in the allied professional services. So I'm not saying that it should be on the clinicians themselves, but the system should have a way, just as how they will take your medical history. Sometimes before you enter into the doctor's office, there needs to be a process in which persons are given an intake that it's not necessarily the clinician, but an allied professional who is able to explore some of the issues that are going on, and then uh, put it in a way that helps the clinician. So the burden isn't on us to figure it out before we go to the doctor. But when you go to the doctor, there is a support professional that helps you to unpack some of the issue, I should say, unpack some of the issues that you are experiencing, right? And so, in the 15-minute session with the clinician, if it's shorter, at least they have more information that they can use to help you, help us come to a decision around what may be an issue.
Mentioned preeclampsia, so that's a term that we use to describe this condition of high blood pressure in pregnancy. There is high blood pressure for sure as a feature of preeclampsia, but the condition is really one where the body is exposed to a kind of stress. It's a sort of an inflammation that travels throughout the body. We believe that it starts with the interaction of the pregnancy itself, the placenta, and the uterus, the womb, so the maternal part of the pregnancy and the fetal part of the pregnancy. And when that connection, for whatever reason, is not solidified in a favorable way early in pregnancy, it can lead to many things later in pregnancy. One of them is blood pressure. People also experience a loss of protein in their urine, and go on to develop dysfunction with or problems with their liver, and can even develop seizures in the most severe form of this condition. What we know about preeclampsia is that if you have it, and you're more likely to have it if you're a Black person, that in the future you're at risk for a number of different kinds of conditions. So remember, we were talking about risk factors and what things to kind of write down in your notes to remember about your health. What happens to you in pregnancy is profoundly important to your future health. And so we are now understanding much more about the future risks of heart disease and women who develop preeclampsia during pregnancy. We're learning about the risk of stroke as well. So remember, we're talking about the heart as well as all the blood vessels that are interconnected in our bodies. And so this requires ongoing monitoring. I am sorry to say that I don't think we're doing a great job at doing this type of monitoring in the health system. If you have an infant, you have a number of visits, postnatal visits. You go for vaccines, right, and checkups for your newborn, and they're like every 2 months for a period of time, and then every 6, and then every year, I guess. And so we do that for our children. But if we develop preeclampsia during pregnancy, we actually need to do those kinds of checkups for ourselves as well. It's actually that intensive. It means blood pressure checks and also looking for protein in urine as markers for the development of heart disease in the future. So this is of particular importance to the Black community because we carry higher risks for these kinds of conditions.
And are there any preventative measures we can take during pregnancy to limit our exposure to preeclampsia?
There absolutely are preventative measures that we can take during pregnancy. It's even better though if we could do them before pregnancy. But anytime. But we know that just to reduce the risk of high blood pressure conditions like preeclampsia and pregnancy, a healthy diet will absolutely impact that risk, and regular exercise. I'll say activity because activity can mean different things, and it can mean exercise, it can mean walking, it can mean different kinds of activities for different people. But if you have 150 minutes per week of activity and healthy diet, that will already start to modify your risk. And then we do have this other magical preventative treatment. It's not magical, it's been proven now. But we know that low-dose aspirin is a highly effective preventative treatment in pregnancy for people who are at risk for preeclampsia.
Wow.
On the cardiovascular panel, there were just a lot of striking data. And I hope I have captured this correctly. But basically, without statistics, because I'm not sure of the statistics, Black people have lower incidences of heart attacks than other races. So that's something I didn't know. Like I just thought they're like along similar trajectories, but Black people have lower incidences of heart attacks than other races. But the disparity comes in as it relates to getting proper treatment. So, though Black people have lower incidences of heart attacks, strokes, and all of those cardiovascular conditions, because they receive substandard or less optimal or bad care, they then have a higher rate of mortality. Think about that. That is just horrendous. That's just, it's not acceptable. So, what we need is more education. We need more education around symptoms. We need to know when we're feeling at a squeeze or nauseousness without any reason, when we are sweating profusely and we don't understand why. We need to know what triggers we should be looking out for so that we can go to the hospital, the emergency room immediately. So these are conversations that we need to have within Black communities. For Black focused community health centers, these are conversations, these are workshops and health education and health promotion material and sessions should be held around these topics because they impact Black and minority people in such a significant way. So, though we have lower incidences compared to other races, or mortality rates are high, that shows that significant racial disparity.
Sometimes it's essentially a sensation of shortness of breath without necessarily having that chest pain component. And so it does make it challenging, right, to try and figure things out, because I'm sure everyone here in this room has felt something like this perhaps within the last 2 weeks. It's true. I think it makes it's true. And so then the question that becomes, well, people then ask me then, what do I do about this? How do I distinguish this? And I tell people, like it is like you know yourself and you know your bodies. And some people know our bodies better than others. So I do think, it is incumbent on ourselves to kind of have an active process of knowing ourselves and knowing our bodies and knowing, what are the aches and pains and nausea that we know we've had from time to time over the past 5 or 10 years, and what is new. And if you do notice that this is something that is new, where you know that this is not right, this is not your body, then it becomes important for you to recognize that, not dismiss it, seek attention. But then it also becomes important for you that when you speak to the healthcare provider, whether it's a doctor, whether it's an ambulance, the person who meets you with the ambulance, whether it's the nurse in triage, it is important for you to emphasize to them that I know my body and this feels different. I feel short of breath, but this is not the shortness of breath I usually feel. I feel nauseous, but this is not the nausea that I usually feel.
So we had a fantastic time at the Black Women's Healthcare Summit. I am actually looking forward to next year. There was opportunity for networking, and there was just this wonderful environment of sisterhood. I mean, every woman that I looked at either smiled back at me, or I smiled first, or complimented me, or I complimented them. I mean, it really just gave you a moment to just sigh, just give a sigh of relief. And so it was really great. And I hope that these clips that I did um, will give you a taste of it. Please go to other summit and conferences in your neighborhood just to be around like-minded individuals who also value the same thing, right? We want to improve health for minority populations. And you also get a taste of some of the data that's out there. It strengthens your understanding. And if you're in a healthcare leadership role, it then gives you more information that you can support in program development for your communities. So enjoy these few moments, and I will see you back here. Have a good day.